Good evening. It's great to be here. I first want to begin. I'm just going to be speaking for a few minutes, so just to make a few comments to kind of set the stage for our upcoming speakers. But first, I want to thank the Ministry of Health. I think at first we have to recognize that this is the ministry's support of mental health initiatives is actually pretty unique. So this is an incredible situation for most ministers of health. It takes quite a bit of work to convince them in order to support mental health. So the fact that we're here in the ministry to support this effort, I think is impressive. Also like to thank SPEAK, of course. I think it's a type of organization that is needed to raise public health awareness about mental health. Absolutely critical and one major piece to the puzzle. And of course, Alan and Lau have been tremendous to work with over the last 9 or 10 months, and we look forward to following their bright careers. And I also would like to thank Ashika Orad, if I said it correctly, but thank you for your kindness and generosity as well. You've been tremendous with our team that traveled here. So the overall message is there is no health without mental health, and that in order to be healthy, you have to be healthy of body and healthy of mind. And so when we neglect the mind component, that means that we're not healthy, and we're suffering, and we're not functioning and thriving. So it's not just to be alive, but it's to live life to its fullest, to be able to do that. And if we neglect mental health, it's difficult to in fact do that. So some simple definitions. What is mental health? People say all sorts of things, but it's the absence of mental illness, which makes sense. But it's positive mental health. It's that you wake up in the morning and you say, I feel good, I'm ready to go, looking forward to doing this and so on, and getting the day started. It's a state of mental well-being. Again, it's about feeling well, feeling healthy, mind and body. What we do understand is that mental health has really become an international, global public health concern. I'll tell you a few quotes. One is that we believe that mental health is just as important as physical health, maybe even more so. And another quote, the challenge to humanity is to adopt new ways of thinking, new ways of acting, new ways of organizing itself in society, in short, new ways of living. And that really incorporates the mental health. So we are not simply talking about the sickest patients, people that require hospitalizations and so on. That we have to pay attention to and care for them. But there's a whole spectrum by which people need help, and numerous methods by which people can get there to get help. It's not necessarily seeing a psychiatrist. It's a whole bunch of pieces that need to be put in place so that individuals can seek help when they need it, when they're in distress, and so on. And it's actually available close to home and accepted within the community. What we do understand is that mental health and mental illness really is a key factor in a number of medical problems. So the relationship between mental illness and a number of medical problems are quite strong, including diabetes and cardiovascular disease and cancer. If you look across the board, mental illness is tied to these disorders, sometimes increasing the risk of getting them, and sometimes increasing the risk for poor outcome if mental illness is not addressed. So again, when we think about health, we have to think about physical health and mental health. And so this slide really just points out the burden of neuropsychiatric disorders, including depression, which really drives it, schizophrenia, but even epilepsy, a neuropsychiatric disorder. A large portion of the disability is caused by neuropsychiatric disorders. And then if you look at all of the other medical problems in this pie chart, we see that they're all tied to mental health. So if you're going to talk about cardiovascular disease, if someone has depression and heart disease, and they have a heart attack, there are outcomes are going to be worse than someone who did not have depression. And same for just about every disorder, diabetes, the ability to control and to follow your diet, check your blood sugar, adjust your doses of insulin. If you have depression, you're less likely to be able to do that. And then that increases your cardiovascular risk and so on. So it's all tied together. So addressing mental illness is absolutely critical. There are a number of barriers to people being able to get care. Some of it is the systems related, some of it is the resources and availability of care, not enough professionals, not enough integration. We'll hear tomorrow a lot about integration within primary care medicine. So some of it is simply that which can, from a system standpoint, with a strong policy and strategic plan, can be addressed with the support of the community, key stakeholders, and the ministry. But stigma, on the other hand, is something that is also a major barrier. And the word originally referred to a mark or brand that was put on Greek slaves to separate them from free men. So discrimination, separating one from another, but it's a sign of disgrace or discredit which sets the person apart from others. Stigma is actually quite powerful. It leads to shame, blame, secrecy. People call them the black sheep of the family. People are isolated or hidden away in the family, the social exclusion, and there's hopelessness. And hopelessness leads us down another path. And this is why in many psychiatric disorders untreated, the risk of suicide is significant. Hopelessness. You wake up every day and you have no hope. It's hard to get through the day. People suffering from mental illness have to deal with both the consequences of the illness, and I tell some of my patients sometimes, taking care of your illness is your job. That's your first job. You have to manage it. You've got to do quality of treatment. You have to do all those things that make you feel well. But on top of managing the illness, they also have to deal with the stigma, which interferes with a lot of things. Number one predictor of stigma is having the label of mental illness, causing people to avoid treatment, and the label, as well as maintaining secrecy in order to pass or get by. And sometimes, we contribute to it in a way that people, trying to hide their illness, but then we give them medications and make them gain a lot of weight so people know that something's different about them. They change, and particularly we see this with adolescents and so on. But it's really important to recognize that labeling people is quite traumatic. And individuals are not a diagnosis, they're people. They're people. They have a medical problem. And it may be that medical problem is depression. Maybe that medical problem is schizophrenia. Maybe that medical problem is anxiety. But they are not anxiety, they're people. And we have to remember that as well. And I spend more time laughing with my patients than anything, because they tell funny stories. They're as entertaining and interesting as anyone who could walk through my door. Now, this is the consequence of stigma. Now, this is not here in Kuwait. This is taken somewhere else. But I've been to many countries where I've seen individuals change inside the house or outside the house in order to keep them from running around in the community and stuff, or hidden from the community. But as you can see in the bottom picture, with treatment, we do have effective treatments. Using programs, looking at discrepancies in funding as well. Then there's the media level. The media plays an important role in reducing stigma. We can see, there have been very effective public health campaigns here in Kuwait for other medical, like breast cancer. Our awareness, I think, has increased significantly. So the media can play a significant role in reducing the stigma around it. But it also means that we have to educate the media about mental illness and get rid of some of the stereotypes that the media themselves may have around it. And then there's the group level, public education is absolutely critical. And then there's the individual level, working with the individual person and accurate diagnosis and responsive treatment, coping strategies with individuals, and overcoming stereotypes as well. I think that sometimes my patients are the best way to reduce stigma with other patients in their families. So they'll go talk to them and share their story, and you see that, they were able to go back to school. I have patients with schizophrenia who are in medical school, and doing quite well. So we know that with effective treatment, people will do well, but there needs to be a sharing of that information instead of everybody trying to hide information. So I think that the role of reducing stigma is absolutely critical, and I showed this slide this morning, and I just love this quote because every day and every time I see this, it makes me want to work harder and do more. And so I'm now down to about 4 hours sleep a night, and trying to do my best. But it says, you must be the change you want to see in the world. And I think you changed the quote so that you must be the change you want to see in Kuwait. So everyone in this room has a role to play. So thank you very much. And next, are you going to introduce Dr. Hennry? Okay.